What's up, everyone? Welcome back. My name is Dr. Peter. Today we're going to be watching and reacting to The Pitt. I don't know if you've heard of this show, but every single person in my life, as well as my internet life, is talking about The Pitt because apparently it is the most accurate medical TV show of all time. Now, we've watched a bunch here. Good Doctor, Grey's Anatomy, Scrubs, and while some of them tend to be drama and others comedy, they all tend to have some medical inaccuracies because they're actors playing doctors. So today we're going to be watching this and reacting to it, and at the end we're going to be rating it on a scale of 1 through 10 regarding its medical accuracy, its acting, and its script writing, because you need all three to have a successful show. And I, as a doctor and pediatrician, but also as an actor, I'm going to give you the inside scoop and see what kind of errors we could find, but also praise them for the accuracies that they do have. And if you like reaction videos, this is the place for you. Hi, welcome. My name is Dr. Peter. I'm a pediatrician and actor, and I love doing reaction videos and watching movies and TV with you and finding the health lessons together. So if that's your sort of thing, you're in the right place. And if we get 300 likes on this video, I'll know that you want me to do a second episode. All right, enough talking. Let's jump straight into it. Or I guess into it. Oh, it's the Pitt in Pittsburgh, but it's also the Pitt. The ER is a pit. It's a good name for a show. He looks like... Oh my gosh, he looks like every single person who works in the emergency department with the rolled up sleeves and the khaki pants and the coffee with the AirPods. He's just missing a helmet and a scooter. My lord, that's great costuming. And he even walks like them. Casual confidence. I can't with the costuming. Oh, good audio design. There's a baby! Yay, we're gonna have a pediatrics. Hour 1. Oh, is this gonna show the whole shift based on hours? You guys got rooms? Some emergency rooms here in New York City don't even have rooms, and patients are just on stretchers in the hall. So I don't know where this is, but it looks very organized just from the start. It's probably gonna be more chaotic. Oh, there they are in the hallway. I spoke too soon. Ooh.
I like to say it goes away, but I had morning sickness for 6 months with my second daughter.
Oh, she's pregnant.
Thanks. It was worth it. You tell anybody yet?
Ooh, my prediction, red shirt is a resident, and she can't call out sick because she is not allowed PTO or she's going to ruin the flow of the system. She's a trainee. I bet you the way she carried herself and the cardigan really gives it away.
Not until I passed 12 weeks, not this time.
Nothing but good vibes.
She had a miscarriage in the past?
Bobby's working today. Today's the day Doc Adamson died. He hasn't worked it in 4 years. So if he's a little prickly today, give him a pass.
This woman must be nurse manager or something. She knows how everything's going down. Girl, you got the pressure of residency on your shoulders. That's all I'm going to say. This is so good so far, establishing some drama, some dramatic elements, plot points that need to be explored.
I spent the last 2 hours coding it.
That's always a rough way to end the night.
Just for context, for anyone who might just be curious, coding is when someone comes in critical condition, unresponsive, and you have to do the full CPR, but with the medical interventions, giving epinephrine, and it can be an extremely taxing. To do that for 2 hours means that people were really trying to save that life. And in pediatrics, we also do it for a very long time. I don't know exactly how long they do it in the adult world, but whenever I've been part of those, it's... You never want to be the one to say and call the time of death, but at some point you have to respect the body. Wow, okay. But that's what's really hard about the ER. They just are the front lines and they see everything, and especially during COVID, they saw a lot of death, and to think that doctors don't feel that emotional toll, I think is insanity at its core.
I can't think of it.
Oh my gosh, dude! Are you gonna jump?
Because this is the job that keeps on giving. Nightmares, suicidal tendencies.
Yeah, dude, back away. The camaraderie of the ED is unbelievable.
Unfortunately, the Kraken is still boarding a BA.
Still? Guy's been here for a week waiting on a psych bed.
Yep, he's only getting worse.
Oh my gosh, there's so much to talk about. Okay, really quickly, just because I'm really passionate about it. There's a huge mental health epidemic in this country, and when someone comes in, especially a teenager, coming in reporting thoughts of suicidal ideation or intent or plan, then we have to make sure that they're evaluated by psychiatry, and if deemed appropriate, then they need to be placed in an inpatient ward. But there's such a bottleneck to get into an inpatient unit, so they usually just wait in the ER because you can't legally or medically discharge them because they are still suicidal, but leaving them in the ER makes them more suicidal because then they are not allowed their phones. It's very hard to get them to get phone calls, and they're eating 3 meals but always being watched. They don't really get to shower all the time, and the ER is not a very comfortable place, so it is unbelievable.
Melissa King, I will be joining you today. I just came from 2 months in the VA.
Hey, welcome to the Pit. This is Dr. Jack Abbott.
Nice to meet you. I can't take a hug.
Oh my gosh, she's so precious. Keep her safe. Oh, she had 3 seconds on screen, but I adore her energy. If someone walked into my team like that, I'd say, you are perfect. I will not let anything harm you. Oh, she's so excited to learn. It's so refreshing. Ah, man. She's great.
Excited I am to be here today, so.
I already love this show.
I married my second husband, Everett, in 1964.
Oh my Jesus. Let me chew. When you go see a patient, you have to, and this is the ER, so you have to be medical history, surgical history, meds, allergies, move on. And then, because you have to get to the core of what brought them in, and also triage, because you have really sick patients who are at death's door. So I'm sure she's there for a very valid reason and sharing this for a very important purpose. It's just very funny to me because you come in and you're like, hey mom, so what brought her in today? And she's like, well, you see, back in 1874, what does that have to do with today, ma'am? And she's like, well, I'll get there. And eventually they do get there.
Hi. Sherry, I'm Dr. McKay. I have some student doctors with me.
Girl, do you got a mask? You in the ER. Personal protective equipment. You don't know what this woman's carrying. Infection control. This was filmed recently, right? This is post-COVID ER. Nah, mask up, my friend. At least maybe here in New York City because we have international airports and anyone from around the world could be carrying anything at any time and spread it to anyone, anywhere. So the infection control needs to be optimized.
What's going on, Sherry?
I burned my
Ah, that's that! Is that leishmaniasis? Burned my hand? Oh, okay, it's a burn.
We've been here for hours and I have to get them to school. Do you know how much longer this will take?
Oh my lord, call a social worker right now. The inner pediatrician is firing. I'm not on shift right now, but I feel it.
Everyone calls me Mel. I'm so happy to be here.
Great acting.
Denis Medical, MS4.
Medical student, MS.
We got 2 traumas from the T. 5 minutes out.
Okay, copy that. Actually, this is the most important person that you're going to meet today. This is Dana. She's our
Charge nurse. There it is. Told you.
And our department is mostly clogged up with boarders. Those are admitted patients waiting for a room upstairs, sometimes for days. Beds are a very precious commodity around here.
I'm appreciating the script explaining to everyone what these words mean, so as they use them later in the episode and later in the season, everyone's on the same page. Wow, excellent, excellent, excellent. Whoever wrote this show understands how to get your audience on board. Bravo. And not in an expositionary way. It's not, this is the Pit with a narrator in a British accent. From a medical education perspective, it is great to be oriented to a new unit because think about it. You start a new job, new place every month, and you have no idea what's expected, but all the patients expect you to do the job, and all the doctors expect you to be helpful on the team, but no one orients you. For example, I was with on a service one time, and they're like, the patient needs oxygen, go put her on oxygen. I was like, and that is where? And they're like, you'll find it. I'm like, I don't think that's how medicine should work. I shouldn't be turning valves on and not know what they're gonna do.
Your senior residents are Dr. Collins and...
She's a resident! Told you!
They report to me. Okay? Great.
Also, I have so much to share, but just this is important. Medicine has adopted a militaristic hierarchy, so the students report to the intern, reports to the second year, reports to the third year, reports to the attending. You can kind of jump if depending on the urgency, but that's typically the order. Okay, so she's screaming, so she's less injured. Maybe not.
Okay, trauma two, let's go.
She's able to scream, so she's still with it. The other guy is intubated and out.
Here we go. Ready? 1, 2, 3.
You have to do a primary survey, secondary survey.
Bilaterally, but we need to protect his...
Apparently, you jumped down to save the lady when he climbed back up.
Okay, what she started saying, breath sounds bilaterally, is the primary survey and secondary survey of a trauma. Primary survey is A, airway, if the person's able to talk, or do you have airway intact? You can't move to the next letter until you address the letter. So A, airway is already intubated. B is breathing. So is the air going into both lungs equally? C is circulation. Check the pulses bilaterally. So bilaterally means both sides. And then you do upper and lower extremities for the pulses. D is disability. So the Glasgow Coma Score. We talked about it, I think, in the transplant NBC video. It's basically someone's mentation status. Can they move their eyes on their own? Can they speak on their own? And can they move their body on their own? So you have to give them a score somewhere between 3 and 15. And depending on what the number is, you have to intervene. If it's less than 8, then you have to intubate them. And then E is exposure. You rip all their clothes off. If you can't rip it off, you just cut it off. It doesn't matter if it's bougie as heck. You're cutting everything off. You check upper body, lower body, back, neck, just so we understand what's happening right now.
Please slip. Go back into the side.
It's more of an arch. Mel, right? I need you on the E fast.
Which is like an ultrasound to see if there's bleeding inside.
He's probably anticoagulated for AFib. Check his medical record, see if he's on a DOAC. Standby before factor PCC if there's a brain bleed.
There's just so much to even comment on. I can't go through everything. My gosh. These actors are saying it in a way that sounds believable, which the interesting thing about the show, in case you didn't know, is the actors got hands-on medical boot camp training, which I love, because as an actor, you can appreciate the respect for the craft, and method acting is its one thing, but to get your full training in a field you're going to be representing on camera is just wonderful that they went that extra mile for these actors to help them and acquire. Like when we were watching Grey's Anatomy, one of the actors said, we're going to call a surgery consult, because the word in English is consulting, but the way we use it in medicine is consult. So that's how you can tell someone wasn't actually advised on the nitty-gritty stuff. So the way that they're talking right now is really impressive, actually.
Ma'am, what's your name?
What's your name? See if she's able to talk.
Speak any English? Airway and breathing.
Yeah. She's screaming. Oh, it's so great that we talked about it now. You're already a doctor. Airway and breathing are intact because she's screaming, so she's able to vocalize on her own. A, B, and now C is going to be pulses.
As is circulation.
Circulation! Ah!
Hand scanner, let me know when she stops screaming.
Is that woman surgery? Because she carries herself as, like, bothered from the start. Surgeons are great people. I'm just saying the stereotype of what Hollywood would represent as a surgeon.
Bring me up to speed. Intubated for agonal respirations, GCS-5, probably.
GCS-5, Glasgow Coma Score. It's less than 8, so it needs to be intubated. We're so good here. I hope you're learning a lot.
Dr. Rabinovich, do you have a moment?
I'm just a little busy right now, Gloria.
Is she, administration? She carries herself like she's important, but doesn't actually have important things to say.
I take it you're free now?
Oh, girl! You not read the room? Are you good, Pinky? Are you aware of what's happening? These people are saving lives. I bet you she's hospital administration. I bet you she gives off the same vibe as the other show we just watched, St. Denis Medical, which if this is too much for you, I completely understand. There's a comedy version of Hospital Antics, and it's called St. Denis Medical. I love that show. There's a woman who's the admin there too. My lord, she is totally admin. I am going to put money down.
We need to talk about your number.
I knew it! This is unhinged! Oh. I don't know if I can continue.
Do you know how likely patients are to recommend this hospital?
This is an emergency department, not a Taco Bell.
Ooh, that needs to be posted across Times Square. That's a the script, people, I'm just going to give it to them now, A+. You know?
We don't have the bed.
Just don't want to hire the staff you need to care for.
Are you still employed? Only people in the ER can say things like this because the ER is so severely understaffed everywhere nationally. So they could be tough because they also are the front facing of the hospital, but also they deal with all the bureaucratic nonsense with getting patients from the ED upstairs, from the ED transferred, from the ED back home, from the ED to the pharmacy, from the, like the ED is healthcare to the point where if you need to follow up for something, or if we need a baby to follow up with a lab value and the clinic is not open on Saturday, or the lab is not open on Saturday, or the radiology suite is not open on Saturday, you just send them to the ER and you're like, that's healthcare. You can't stop someone from coming to the ER. And look at his face. He's like, we're doing a good job with the resources we have. I love that.
So you can either step up your game or you can step aside.
Are you able to identify a villain when you see one? Good, 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 good. Just clarifying that we're all on the same page. How did they make this? Good job, set design. Yep, yep. They would not be doing this in an ER.
My student down.
It's at 98.2.
No fever. Because a fever is... Dun, da, da, da. If you watch my channel, you should know this by now. Yay! That's right. 100.4 degrees Fahrenheit. Or 38 degrees Celsius. And in Spanish, it's 100.4 o 38.
No good deed goes unpunished.
Wicked? Is that a line just outside of Wicked? That's where I know it from. But Wicked?
Oh, has anyone notified the family?
Oh, she's a gem!
I could try.
That's not surgical. Get an internal medicine consult or admit to medicine with ortho consulting. Either way, I'm off the case.
Yep, called it. Surgery. Wow.
That was wicked.
Wicked!
High potassium and renal failure. Just what you thought.
Must be my lucky day.
Ordering 10 units of regular insulin and 25 grams of glucose.
Why give insulin when the patient is not necessarily diabetic? What? Because insulin also pushes potassium into the cells, so that's not just swimming in the bloodstream. It's like, ooh, potassium, you're too high. We'll put you back inside the cells where you can work and do your magic. And then you give glucose so that, because insulin will also bring the glucose level down, so you don't want to make them hypoglycemic. Hypo, low, glycemic is glucose. You don't want to make their glucose level low, so you're going to give them glucose and insulin.
Why insulin glucose?
A girl that you can answer! I'm really vibing with this show, like, on every level. This is my show. This is our show. I hope you're learning, because this is amazing.
Potassium intracellularly?
Exactly, but the definitive treatment is...
Dialysis, alcohol, renal, and get a tech down with the machine.
You shocked my heart?
Long story. Dr. Collins will fill you in.
She... Oh my gosh. Here's what's happening. She is a resident, and the senior resident. So like I said, the chain of command comes up to her, and she's the last step before the attending. So, the reason why this is important is because what's happening as the subplot is we remember, and he doesn't actually know, or maybe he does, but she's also pregnant. And stress is horrible for the body, just for all of us. But for someone who's pregnant, it can lead to miscarriages. So, and she already said that she said she wants to not tell anyone until she's past 12 weeks, so it sounds like maybe last time it was a miscarriage, and she works in the ER. Residents in general have horrible health, they have high rates of suicide, and they have horrible stress levels. Residency is simultaneously supposed to be an educational training program, yet entirely an employment, and you can't leave patients to die because that's your employment, but you also can't really do all the administrative stuff for the education because then they get, like, Pinky when she came in over, he as the attending can push back on her, but as a resident you can't really push back on administration yet because most residents are not unionized so far. But a lot of us are working to change that because it's just a nightmare. And so I feel for her. That side eye she gave him said a lot of she's feeling it. Is he gonna pick up on it? You have some high emotional intelligence, my friend.
You guys say? You okay?
Why wouldn't I be?
Why'd you shock my heart?
When your kidneys don't work, potassium builds up and messes with the electrical activity in your heart.
Good on the script writer.
Then I'll be okay.
Yeah.
Ooh, you can't really say that. You have to say we're doing our best. You have the best people on the job. We are a team committed to your wellness. You can't really say yes, you're gonna be okay. He's gonna die. He's gonna die because it's a pilot episode and they have to establish trauma for us as the audience. He's gonna die.
89-year-old woman from a SNP. History of emphysema, CHF, MS, VFib, unresponsive to 3 shocks, 2 rounds of...
Wow. This machine right there is medical innovation. It is doing the chest compressions for them. You see it right there in the center of the lucus? Instead of, which you all should know, hand, over the center, press with locked elbows, so straight armed, and you just keep compressing. And this, because it's very exhausting, this will do that for them.
What is that? Lucas chest compressions.
What is happening? I promise you, this is my very first time watching it. I just love teaching, and I have medical students and residents, and I know what it's like to be lost, so I've been teaching them, and I've actually been blessed that they've really appreciated it and like given awards and stuff, and I hope that you are appreciating this as well.
System.
Robotic CPR.
Exactly. Wow.
there an advance directive?
No, full code for the nursing home.
Seriously.
Oh, yeah. This one's a really dicey subject, advanced directives. Please talk to your loved ones about what you want to be done for you in the case that you are become unresponsive. The reason why this is so critical is because when you can't make decisions for yourself, you need the people who love you most, because they will be contacted to make those decisions for you. If you want the medical team to do everything in their power, great, we will. But if it's not known, then people just have to sort of guess, and you put your family in a really tricky situation, because some people are like, we don't want them to suffer anymore, and some people are like, but they want to live a long life, but what is the quality of that life? So for this woman, she's elderly, and now like they have to do a full code and like shock and do that whole chest compressions and stuff, and you are gonna break ribs when you do that, and the quality of life after that is, you know, not necessarily the greatest. So talk to your family, make sure that you know what your parents, your grandparents, your uncles, your aunts, yourself, your kids, what everyone wants, because these are really tricky situations. I would love to hear your thoughts about what to do in this specific situation in a case, because someone, they didn't know what his advanced directives were, but he had a tattoo on his chest that said, "Do not resuscitate." And so when they cut his shirt open to start doing CPR, they saw it, and it just created a huge, like you just see, this is utter chaos, or you just see this is utter chaos from start to finish, and these people are trying to save lives, and when they saw that, they were like, do we intervene or not? And I just want to know, what would you do in that case? Because you're supposed to respect the person's wishes, but is a tattoo an explanation of those wishes? And if they didn't act and that person died, but the family had wanted it and said that he expressed that he wanted it, it just makes things really confusing. So what do you think? It's a very ethically challenging situation. This is just so you know the full scope of humanity. Some people want their elderly relatives to stay alive because they can collect on Social Security. So you have to really take care of vulnerable populations.
You're my responsibility. And when one of my responsibilities takes a header... Wow! Abbott called for a surgical consult on the SBO 3 hours ago. You're very lucky they didn't perf.
I'm here to see my daughter.
I'm sorry, is that a patient?
You're talking to her.
No. We're gonna discuss nepotism? We're gonna discuss nepotism in medical education? Are you serious? Oh, lordy, lord, 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 lord. They have to give this justice. You can't just be in the middle. You have to make a statement about what this is. They're really setting up a whole season, my lord.
Am I interrupting?
No. No. We're done. We're good. Come find me when you're ready to present your next case.
Thank you.
No! He hasn't faltered to anyone, but to a surgeon he did.
Thanks for coming down, Mom, but I've got a patient. Bye.
Ooh, girl. She was forced to be there. I'm calling it. She was forced to be in medicine. She wants to be a classical dancer or a flutist. Flautist? That one. Flautist. Flutist? Play the flute.
I have a lethargic 4-year-old.
Don't bring kids into this. No PMH, past medical history. No fever or vomiting. All right, let's work through this together. Pediatrics time.
Parents just
Couldn't wake him up this morning. Okay, so what are we thinking? Did he ingest something from the family? Are any of the parents on any medicines? When was he last responsive? Did he choke on something? Is he breathing? So his blood glucose is 85, so he's not in diabetic ketoacidosis. My guess is he ingested something.
Pills, vitamins, any prescriptions that may have been left around?
No.
Why are they taking this so casual? This is also an emergency. You have to run labs immediately. Did he seize?
bumped his head recently.
Not that I'm aware of, but he does the rough housing with Drew.
But he never gets hurt. Oxygen level is...
Who's Drew? Oh my gosh. Is Drew the father? I'm very concerned. Whenever there is, unfortunately, someone who's not the actual, I mean, even if they are the biological parents of the child, full flags. Who's Drew?
We're going to start with blood and urine tests, check for any metabolic abnormalities.
Dude, call peds. Why is this, everything else is an emergency? I'm so bothered by this presentation. This is not medically accurate in the slightest. You can tell that, I mean, I don't know if they're just trying to give a lull because not everything can be utter chaos all the time, even though it is. From an audience perspective, it would be too draining for us. But that's not medically accurate. Peds would be flying off the rocker for that kid. It's actually unfortunate for me to see that because everything else has been so medically accurate so far. And the one thing that's not is peds. So either that means that they think it's okay to skimp out on peds, or, which I don't think is the case, the person who helped them understand how to make this show didn't understand pediatrics enough, because that is not what we would be doing in the slightest. We wouldn't be like, we're gonna run some tests and be back. We'd be like, what the?
So sorry, ma'am. We don't understand.
Does anyone know what this language is? Can you understand this?
She's got a bad burn, needs wound checks and hand therapy, and I got a sneaky suspicion she may be unhappy.
She's a social worker?
I'll talk to her. We can offer some help.
Oh, girl!
Appreciate it. It's Kiara Alfaro. She's a department social worker, which pretty much makes her an angel.
I love social workers. They're literally the greatest people in the world. If everyone could be a social worker, this whole world would be so nice. Social workers work so hard. I actually made a song for social workers. I'll link it down below. It's just, they work so hard and they fight against all the horribleness in healthcare. Overworked, underpaid, underappreciated.
Can I actually ask you a personal question?
I'm 20, and I've earned the right to be here.
Oh, that's cool.
All right, so let's just walk through that really quickly. She's 20 years old. Let's say she finished... Wait, what? No. She finished high school at 18. There's no way she's 20 years old and in medical school. 17 when she finished high school. 16, we'll give her 16, and then she started a 7-year program. For anyone who's considering being a doctor, you could do a 7-year program which combines college and medical school together. 21 would be the earliest she would be in the hospital, unless she's like rotating for fun or her mom got her it while she's pre-med, but not as a medical student. I don't believe that. 21 is the earliest I would accept, and I gave her a lot of goodwill.
And as for the age thing, I'm a 42-year-old R2, so I have my own haters, trust me.
He's 42, girl. You look great for 42.
Otis's BP is crashing, 70/50.
Otis!
For dialysis. Static collapse of the right atrium and right ventricle.
He's got cardiac tamponade.
Yep.
So there's fluid around the heart that's compressing the heart so it can't pump as efficiently. They're gonna do a pericardiocentesis. So like put a needle in and pull out fluid.
No, just open a central line.
I just want to look at the vitals machine because I want to make sure that the vitals are correct. This is set design. Where's the blood pressure? It doesn't actually show it, and that's what would be the lowest here, because every time he takes a deep breath, this is super science, this is really interesting. When there's fluid around the heart, it's compressing the heart, so the heart can't beat as efficiently. And when you take a deep breath in, as you do that, the lungs get bigger and also compress on the heart, so the heart's blood pressure, your blood pressure overall, drops when you take a deep breath in, and we call that pulsus paradoxus, which is a quintessential buzzword or key finding when someone has cardiac tamponade. Oh, there's the blood pressure! 75/50. That's really horrible.
I'm going in right over the center of my probe, advancing very slowly, looking for the hyperechoic tip.
Oh my gosh, hyperechoic tip is when she's going in with the ultrasound. You're gonna look for the part that shines white.
Dr. Santos, you see that sea of black? That's the effusion. We're looking for a little white dot. There it is.
Got it.
Now you pull back.
3 cc should be enough.
Pressure's up 124/78.
Looks like things are back to normal.
That was cool.
In residency training, just so if anyone's concerned when they watch these shows, like how in the world would they let her do it at a time like this? You typically see one, do one, teach one. I actually wrote a song about it. I'll link that down below. It's to Ariana Grande, 7 Rings. It's very funny. But you see one, you do one, and you teach one. So she's probably seen him do it one time. She's doing it right now because she's the senior resident. They wouldn't let the intern do it on her own because this is her first time seeing it, the one dressed in black. And the next time it happens, maybe she'll get the chance to do it while the resident with the red is going to teach her. See a couple, you do a couple, you could teach a couple.
What did you eat last night?
Oh, it was my wife's birthday. Took her out to Sullivan's for a steak.
Cholecystitis, pancreatitis.
It can be pain when the gallbladder contracts.
No way would a med student pull up an ultrasound. I mean, maybe they do, but because it could be being used by someone else for a more emergent purpose, and they'd be like, where's the freaking ultrasound? It's like med student has it in room 3.
All of our labs are back on Sleeping Boy Tyler. All 100% normal.
I'm intrigued, to say the very least. Oh, but also 100% normal based on, my concern is 100% normal based on actually looking at the values or based on the computer system, the EMR, flagging some things as red if they're the wrong values, because you have to remember kids have different lab values than grown-ups, so you really have to be an eagle eye. This is why pediatrics is the best. If you're interested, please become a pediatrician because it's so fun, and you have to be hypercritical like a mega Sherlock Holmes, because the system is built for grown-ups and it will flag things as wrong, and that's how you can tell if a med student didn't actually look things up, or a resident, because it'll be like, oh, it was a normal blood pressure, and you're like, for a grown-up, this is a baby. It should not be 120/80. That's my suspicion.
The lab results are in and they look great.
Lead level? Is he developmentally appropriate?
Danny,
What about Danny?
your brother, he...
Park.
Knew it! I knew it! I should have said it. I promise you I was thinking this because this has happened. This has happened. The kids think they're gummies and they take so much of it. I told you it was an ingestion. Oh, I'm so glad. Again, peds would not be sitting on this. We'd be like, anyone in the family, do any of the things. We don't judge any of the things.
Let me call the lab, maybe the toxicity is back. Hey, this is
Oh, so it's, wait a minute, okay. Okay, we were right. We were checking the urine top.
Can I fast track a lab on a little boy, last name Jones, first name Tyler?
Thanks, I appreciate that quick turnaround.
Your son tested positive for...
Again, they're realizing they have, what, 5 minutes left in the episode, and they're like, we gotta wrap things up. No, don't not stick the landing, incredible show. You have to. But the Pete's case is so improperly treated. Whoever wrote this arc did not consult a pediatrician in the slightest. I'm available. You can reach out to me. Because I got stories, y'all. Oh boy, do I got stories. You look so cute, don't you, little camouflage pajamas?
David, I found some of his writing. I thought it was schoolwork, but
Is
it
he
wasn't.
suicidal?
It was lists of girls he wanted to hurt.
Homicidal, oh my gosh. Oh, I can't. If they're gonna go there right now, it's gonna be a little bit too real for me, and I don't want to live my shift outside of the hospital. I was just talking to someone about this today. This is what makes peds so dynamically challenging, because everything you do has to be for the child, for the patient, to make sure that they're safe and everyone around them is safe. So when a child tells you something, it doesn't matter how busy that board could look in the ER, in the clinic, and this is why parents, please say thank you to your pediatricians. Please, bring them a happy face and a happy smile when you can, because there are so many rooms when you go in there and you can't walk out, because you have to get the full story, you have to make a case, you have to call Child Protective Services, you have to launch this entire investigation, get the police involved, and you are only scheduled for 10 minutes per patient. It's a system that's set up for failure, especially in pediatrics, especially if someone speaks another language, especially if someone actually needs help. And in this case, this is going to be a big thing. And imagine right now a trauma comes in, right? I think for the sake of the story, they're not going to complicate things like that, because he can't. I mean, he'll have to, again, this is the conflict of the work that we do, but he'll have to just stop her mid-story and go take care of something. But right now he's going to take a moment, I think, because this is the story beat. This is the heart of the show.
He just turned 18 last
He's
month.
an adult. Oh my lord.
Then he's considered an adult, and he would have to consent to treatment.
I'll be right back.
Social worker to the rescue.
Yes. And now having to take care of your mom, that's a lot.
It's fine.
We just want to make sure that when your mom goes home, you can handle it. We want to make sure you have someone you can talk to if you need to.
I'm okay. I don't need to talk to anybody.
A good rule of thumb that someone told me in my pediatrics training was, if you talk to someone and you feel depressed, it's likely that that person is suffering from depression. And he's sort of blunted and flat in his affect, affect is the objective thing that a doctor observes about a patient. So I feel about me is my mood, but the doctor feels about me is the affect.
What about school?
What about it?
Anything you enjoy there? A lot of people have...
Ooh, anything you enjoy there at school is a good question, because that is a sign of depression. It's called anhedonia, when you don't feel interest in the things that used to bring you joy.
It would actually be kind of helpful to talk to you some more. Hey, David?
You got hospital security for that. I'm gonna call that real quick. I'm gonna clock that. You got hospital security. You would totally alert hospital security. You would not just chase them on your own, number one. Number two, you would never have a conversation with that with someone who you're concerned about eloping, is what we call it, running away. Like out in the open, you would totally bring them into a conference room, and you would be the closest person to the door, and you would have security on standby if you're actually concerned. And this is why you have policies like that in place, because once you've experienced this, the hospital administration is going to come in and be like, how do we prevent that from happening again? So that whole interaction in that open space was violating HIPAA, and the emergency room in general is very funny because you have curtains between you and the next patient. Sometimes not even a curtain, it's just one stretcher next to the other one. You're just sharing everyone's info out in the open. And actually when I went to Tanzania, which is actually pronounced Tanzania, 8 people on one bed, and it's not even a hospital bed, it's just a mattress. Cool plot point, but not accurate. Call the school, man. You gotta call the school, tell the school counselor to pull him aside. Is he gonna pass out? Good transition! Oh my lord!
Dr. Anderson just went down with a pulse ox of 65.
Oh. Oh, COVID. No. Why did they have to do that? That's not fair. That's an emotional anchor for the rest of humanity. And he saw all his colleagues die. And it ends with that final breath. You hear that? That was really challenging. We can use this to build our discussion right now, where we rate it together on its medical accuracy, its acting, and its script writing. Script writing wise is, I think, yes, the most medically accurate. It gets the check off from the pediatrician as well. Most medically accurate TV show. It's also fascinating from a script writing perspective that they have each episode representing an hour of his shift. So I guess you typically do 12 hours in the ER. You can't do a 24-hour shift in the ER as a resident because it's just such high volume and you could burn out really quickly. And ER doctors have the highest rate of burnout across all medical specialties because they just see so much. They're up against a medical administration, they're up against the healthcare system being broken, they're seeing all these patients from all over the world needing all this different help, and the lack of resources, the lack of staffing, and they're just expected to be heroes all the time. The pediatric section was mishandled and mismanaged. No one would be that casual with peds, but I guess they didn't consult pediatricians for that part. In terms of the acting, supreme. Again, I really applaud them as a doctor and as an actor to have given your actors the training that they need, because when you're an actor, you're trying to live in this world, and all acting is behaving realistically in imaginary circumstances. So I'm gonna give this a 9.2 out of 10. So if we get over 300 likes in this video, I'll react to episode 2. I really do like the show. It started off with that one doctor on the roof, and they kind of joked about, physician suicide, but it is one of the highest, and I talked about it. I'll put a playlist down below of like the sick truth of healthcare. You're always taught that you're supposed to be a martyr. He's like, I don't even have a friend. I don't know if he's married. I don't know if he has a dog. And he's just alone. Thank you so much for watching with me. Oh my goodness, what a hoot. I'm gonna have such a fun time editing this because I'll get to rewatch it. What were your favorite moments? And again, please leave a comment down below. Like, subscribe for more, and I will see you in the next video, which I will put up over here. And please subscribe so we can get over 17,000 subscribers. That'd be so fun if this video does that. And I'll see you in the next video. Take care. Ciao!